Well, good afternoon, everyone. It's really great to see everyone and be with everyone today, this afternoon or this morning, depending on where you are. My name is Stacy Stewart. I'm President and CEO of the March of Dimes. We're really excited about the conversation today, which is so important. And this is, again, another in our series of Healthy Moms, Strong Babies during the COVID-19 pandemic. And we're, again, really pleased to be talking about a really important issue that we've talked about before, but it continues to be an issue that a lot of people want to continue the conversation around, and that is around mental health, especially for mothers. And we're doing this particular episode specifically focused on Black maternal mental health because July 19th to the 25th, this week is Black Maternal Mental Health Week. And it's a very important week for us to be talking about the issues that Black women in particular face with respect to mental health and Black moms face. Before we get into it, I really want to give a special shout out to Kay Matthews of the Shades of Blue Project. She and her organization have been working hard to support postpartum women of color, and she is the founder of this week. And so we really want to honor her and her efforts. She has been a guest with us on previous episodes. She's really super busy this week. So we're really doing this to really honor the work of the Shades of Blue Project and honor the important issues around addressing Black maternal health and so mental health. She has said that addressing Black maternal mental health is not mandatory, is mandatory, not optional. So we definitely agree with that. So we're happy to be having this conversation today because we think it's really important to raise awareness around these issues. We think that, and we know that Black women in general and Black mothers face mental health challenges at greater proportions than other women. We know that poor maternal mental health can often complicate birth outcomes and maternal health. And so it's really important that as we think about improving health outcomes for moms and babies, that we not lose sight of how important it is to focus on mental health, especially during this time, because this country, and all of us can attest to this, is facing unprecedented stress and anxiety. We are facing a pandemic. We're facing a lot of social and racial unrest. As African Americans, we're facing a lot of increased pressure on the issues and the focus on racism that we experience on a daily basis. And that is all compounding the challenges that a lot of us already may be having with our mental health. So we need to just take a deep breath and take a step back. Let's look at this issue of Black maternal mental health. And let's talk about what are some of the issues that as a country we need to do to face what these challenges are and really confront them and deal with them. At the March Dimes, we are really committed to focusing our efforts on improving the way in which we address mental health in this country, especially for moms and especially for moms of color as well. So I want to say thank you all for joining. We have a great panel. I want to introduce them. I am so excited that they're going to be talking and covering this issue and this topic from a range of different perspectives, whether it's around policy, looking at the patients themselves and women themselves, mental health generally, and then how the media even deals with Black maternal mental health as well. So let me just start by introducing them. They are all African American women themselves and experts in this area. I'm going to start with introducing Linda Blunt, who is the president and CEO of the Black Women's Health Imperative, which is an organization that is dedicated to the health of the nation's 21 million Black women and girls. The organization is just about to celebrate its 38th anniversary this coming week, so happy anniversary. And they've been doing some great work over many, many decades, addressing the emotional, physical health of Black women, and have been remaining steadfast in their work for many, many years. So we are really, truly honored to have Linda with us. She is also an author, a true leader, and been a great friend of mine, the March of Dimes, for years, and even before my coming to the March of Dimes in our previous lives. So Linda, we're happy to have you, and so honored to have you joining this panel today.
Thank you.
The second guest is Kelly, thank you, is Kelly Glass. Kelly is an independent journalist, and her work is focused on the intersection of parenting, health, and race. Her writing has appeared in the New York Times, the Washington Post, Parents Magazine, and many more. She's recently covered why new mothers are at high risk of mental health issues and how these issues are compounded for Black women. So Thank you, Kelly, for joining. We're happy to have you. The next guest is Tracy Collins. Tracy is the founder and CEO of the National Black Doulas Association. She's also host of the Healthy Black Girl podcast. She began her career in the birth doula field in 2000 after her second child was born. She's attended over 1,500 or more births in her career, and birthing in women in hospitals and birth centers and even home births throughout the San Francisco Bay Area and beyond. She, in 2017, founded the National Black Doulas Association, which has quickly become a leading resource for birthing families to find a Black doula and a Black birthing professional in the country. So Tracy, thank you for being with us today. Happy to see you. And then our next guest, our last guest, is Jabina Coleman. Jabina is a licensed clinical social worker. She's a lactation consultant. She's the owner of Lifehouse Lactation and Perinatal Services. She's also co-founder and president of the Perinatal Mental Health Alliance for People of Color and co-founder of Breastfeeding Awareness and Empowerment. She has many, many hats that she wears. Jabina's programs focus on parenting wellness, addressing mental health in women and children, and always answering the question, everyone wants to hold a baby, who will hold the mother? Which is the best question we could ask today. So I'm going to moderate our conversation today. I'm going to ask the panelists to just open up with a few thoughts on a question that I'll pose to them. And then we'll have an opportunity to take questions on Facebook Live. So for those of you listening on Facebook, please, please, please put your comments, your questions as we proceed through the conversation. We'll try to get to as many of the questions as we possibly can, and then hopefully have a great conversation. As usual, as we do always in these webinars, we want to invite your participation, and we'll also make sure that you've got plenty of links and resources to go to as follow-up after this conversation has ended. So thanks to all the panelists for joining. I'm going to start with Linda. And Linda, we talked about the mission of the Black Women's Health Imperative, a wonderful organization really helping Black women and Black girls. Tell us why mental health is so important in your work. How do you all incorporate Black maternal mental health, especially into the work at the Black Women's Health Imperative?
Yeah, okay. Thank you. And thank you, Stacey, for inviting me to be a part of this really important conversation. And thank you for your work. If you could just be in every single state yourself and do all of this, this would be wonderful. If you could figure out how to clone yourself, it would be great. We need you. So, Black maternal mental health is important. Black women's mental health is important. A few years ago, we actually conducted a study where we asked Black women to define health. And it was purely qualitative. We just asked for words and phrases, whatever health means to you. And as it turns out, we're close to 5,000 Black women now. About 80 to 85% of the words and phrases Black women used to define health were psychosocial. Things like, I'm calm, I'm at peace, I'm in control. About 10% of the words were financial. I can keep a roof over my head, take care of my children. Only about 5% of the words and phrases Black women used to define health had anything to do with physical health or disease state. So, that kind of said to us, Black women said, well, if I can get my mind right and my spirit right and my money right, I can take care of everything else. But more importantly, it helped reshape the lens through which we look at our work. We do chronic disease prevention and risk reduction, HIV prevention, obviously maternal health, reproductive justice. But we have to start with, how do you feel? How do you feel as a Black woman in this society, in this moment in time? And so all of our work now takes place through that lens, through that frame of what are you feeling and about yourself and about your life. And we talk about the lived experiences of Black women. The lived experiences have to shape our programs, but they also have to inform research and analysis. They have to inform policy and the implementation of policy and the application of policy. So now when you look at our programs that we conduct, our funding mechanisms, and what we write and how we conduct research and do policy, it all starts with, how does that Black woman feel about her life and her lived experience?
And talk about that a little bit more, because I think a lot of people, I think we all as Black women can articulate this for ourselves, but when we talk about that lived experience, what is it about our lived experience that influences our mental health, and how does it influence it?
Yeah. Well, it's interesting, and you know this, there's been research around out about this for practically 30 years. I mean, you can go back to Arlene Geronimus when she talked about weathering and the allostatic load. Well, Black women at any point in time have about 15% more cortisol, which is a stress hormone, in their bloodstreams than white women. And cortisol is great when you need it in an emergency, but chronically elevated cortisol is not good. And so what we see is much of what we look at when we're looking at health disparities, diabetes, hypertension, maternal mortality, is actually due to the consequence of this chronically elevated cortisol. And now we've got research that looks at, frankly, the DNA level. Telomeres at the very end of DNA, the cell division is shorter, these telomeres are frayed. And what we see now is it triggers our inflammation response and metabolic changes. So we can draw a causal relationship between experiences of racial discrimination, gender discrimination, and low birth weight babies, maternal mortality. Probably researchers are thinking maternal depression, and certainly premature mortality from diabetes, hypertension, and heart disease. So we really have to look at what it means to be a Black woman, and the kind of toxic stress we experience every day, and the toll it takes on our health.
And our health in total, both our physical and our mental. Yeah,
Absolutely.
that's good. Kelly, I want to turn it to you. You're a journalist, and you've been keeping a pulse on what's happening, obviously, nationwide, and especially related to the health and well-being of parents. Can talk a little bit about, and you just recently wrote about why new mothers are at high risk for mental health issues, and how these issues are complicated for Black moms. Can you tell us more about what you wrote and what you're seeing?
Yeah, absolutely. I mean, American culture in general just does a poor job of taking care of mothers. For Black mothers, that's compounded by racist policies and all types of racism. We're just becoming more comfortable in the media talking about the chronic stress of racism that Linda just explained so brilliantly. Um, it affects women's bodies, and that's really at the root of a lot of these racial health disparities. And that makes childbirth scary for Black birthing people. The pandemic has obviously added new worries for Black birthing moms about birthing alone, not being listened to during childbirth. And we've not seen the numbers yet on how the pandemic actually affects the maternal mortality and morbidity rates. But if Black women were already at higher risk for birth injury and trauma, and even isolation before the pandemic, that's certainly an added stressor now. So Black mothers are increasingly isolated right now, while also experiencing the vicarious racism of this moment. And that's a lot of stress for a group of women who are already at higher risk of postpartum depression.
It's really, this is an extraordinary time. I mean,
Yes.
to your point, this country doesn't do well by any mother. I mean, our policies to support motherhood generally
Right.
are really inadequate, especially compared to other highly industrialized and wealthy nations. It's especially poor for
Exactly.
women of color. We have even fewer layers of support, and even less access to the kinds of resources that will enable us to maintain proper health and wellness, especially mental health.
Yes.
There are resources, though. There are proven methods that especially Black women have relied on historically
There are.
to help us with birth. And Tracy, I wanted to turn it to you as the founder and CEO of the National Black Doulas Association. Talk a little bit about doulas and what doulas do, and how doulas can help women emotionally through pregnancy, how important doulas can be, especially as as doulas can become incorporated into a birthing plan to really support and provide support especially for the mental health of Black moms.
Well, we know that when women are supported, they feel more empowered. So a doula's role is to provide the necessary informational support, physical support, and emotional support for birthing families. The difference with Black doulas is that they haven't been as visible, meaning it didn't mean that they weren't out there. It just means like, where are all the Black doulas, or how can I find a Black doula in my state? So we're, at the MBDA, we've kind of helped bridge that gap so Black birthing families can have the necessary support that looks like them. And we know that representation matters because we understand things from a cellular level. So in reference to the education, as far as like how obstetrics and gynecology works in this particular country, then we can better help understand the policies and procedures to help birthing families navigate themselves through the most vulnerable time in their life as they transition into parenthood. So doulas help throughout that whole entire process, from fertility to birthing, from pregnancy, birthing, postpartum, lactation, identifying things that necessarily get overlooked in hospitals. They listen. And that's the thing that's missing, is listening to Black women, and being able to help with medical terminology and turning it into layman terms so they can make the best informed decision for themselves, so they can feel empowered in a process and a system that is specifically designed against them.
Having that support is so important. At the March Times, we created a group prenatal care program called Supportive Pregnancy Care, with the intent of creating that support system of other pregnant women around a woman who is pregnant, so that she doesn't feel alone, so that the things that come up in her life, whether they're about her clinical care or just about her day-to-day living as a pregnant woman, that she's got other pregnant women around her, and then also clinical help to make sure that she can manage through a pregnancy. And it's been proven to be very successful. Doulas, there's so much evidence to show how much doulas contribute to improved maternal health outcomes and birth outcomes. We're really glad that you're here, Tracy, and want to continue this conversation about doulas and also about your podcast. So we'll come back to you about that. I'm a big podcast person, so I gotta make sure I'm hearing all about the podcast. So I want to turn it to Jabina and bring you into the conversation. Jabina, you're a counselor, you're co-founder and president of the Perinatal Mental Health Alliance for People of Color. Talk to us about this alliance. What is the alliance? And obviously you thought it was important to have an alliance around mental health, focusing on people of color, but talk to us about what the alliance is really focused on and what it's there to help others.
Yeah, so the Perinatal Mental Health Alliance for People of Color, we are a program within PSI, and PSI, Postpartum Support International, is the leading international organization that focuses on perinatal mood and anxiety disorders. And so the reason why, our why is really because perinatal mental health is the #1 complication affecting women during pregnancy and within the first year postpartum. And this is when we talk about other factors like heart disease and hypertension. And so, we really found that, the statistics, 1 in 7 women experience a change in mood during or after pregnancy. 38% of new mothers also experience perinatal mood disorders, but Black women experience complications, twice that amount in terms of complications compared to white women. And 60% of women of color aren't treated. They aren't assessed or diagnosed. And so we thought it was really important that we created this space within PSI, which is an organization, yes, that focuses on PMADs. However, there needed to be more diversity within and inclusion within this organization. And what we also found was that there weren't enough clinicians of color servicing the communities of color. And so as myself as a therapist, I focus on perinatal mood and anxiety disorders and reproductive therapy, psychotherapy. And Black women who are experiencing these changes don't have an avenue to kind of go and talk with other folks that look like them and who can relate to them. And we know that, you know, your care looks different when the person that's sitting across from you also looks like you. And so we found it really important that we, provided this space for clinicians of color to become trained in PMADs, perinatal mood and anxiety disorders, and also being able to provide communities, marginalized communities, with access to resources and support around PMADs. And so the Alliance was founded about 3.5 years ago on that premise, so that we can definitely uphold both our clinicians of color and our marginalized communities of color.
You know, we're talking about these issues where we've got increased, incidence of issues around mental health, but there are so many barriers to Black women while pregnant and even after pregnancy in the postpartum phase, accessing that care. Why is it, talk about what are those barriers? Like, why is it so challenging for us to seek the care that we need? And what are those barriers and what can we do about it? And I'll just start with Jabina, and anyone else that wants to chime in, please do so.
Yeah, I think one barrier that I find is the stigma around it. And I think that during this time of COVID and just all of the things that we have been experiencing, that there seems to be some nudging with destigmatizing mental health as a whole. And I think that's one of the major barriers, is the stigma within the community. Because if I'm not a whole person, if I'm not a whole mother, if I'm not this strong Black woman, you know, I'm not doing it right. Along with that is the fear of the system. So the fear that if I disclose any of this information to my medical providers, then I may be looked down upon, an unfit, unworthy mother, unworthy person, and the fear that my child be taken away from me. And so those are some of the two barriers that I see, you know, continuously, and the shame and guilt that comes around it, because folks aren't talking about, you know, the 4th trimester. They're not talking about the baby blues. And I like to insert in here, when we say postpartum depression, it is on a continuum. So I used the term PMADs earlier. And a part of my work is educating and bringing awareness to language around postpartum depression, that it is on a continuum, and it also includes postpartum anxiety, postpartum PTSD, postpartum OCD, obsessive compulsive disorder, and what we often hear in the news is postpartum psychosis. And so I think it's important that in terms of the barrier of language and information, we need to also expand how we talk about it as well.
Wow, yes. Tracy or Linda or Kelly, did you want to jump in on that as well?
Yeah, one thing that, oh, sorry, Linda.
Go ahead, Kelly.
Okay. One thing that comes up a lot when I talk to new moms is this idea that if you have a quote unquote healthy baby, you should be happy. And that plays out in conversations between, you know, family members and friends of this new mom. They prioritize the baby. How's the baby doing? You know, and so if the conversation always leads with how is baby doing and baby is doing great, these moms don't necessarily feel comfortable then saying, well, but I'm not doing great. I feel this and I feel that. Yes, the stigma, absolutely. And also the way that we talk about or talk to new mothers after childbirth makes a big difference. Prioritizing them as people.
Yeah. But also, if I can jump in here, just making sure that we let go of the superwoman complex. We come from a history and a culture where our grandmothers did it all, our mothers have done it all, so we must do it all and not ask for help because I'm, you know, the strong Black woman. And I don't like that superwoman complex. I think we need to let go of that and really get into normalizing, I need help, I need support. It's okay, you know, it's about providing safe space. And, you know, Jabina is absolutely correct with that language, expanding that language, anxiety, OCD, that could potentially lead to depression, that hopefully will never, but possibly could lead to psychosis. And understanding that pregnancy is a 2-year term. It's 40 weeks gestation, which is 10 months. The rest of that is postpartum. Then that's at a minimum. The rest of that is postpartum. So understanding the physiology around birth and understanding the fact that the body from a cellular level has gone through a major shift that affects everything else. So, you know, looking at it from various different angles. And then also from a spiritual aspect, we can't negate that, being Black people in America. You know, so we come from a history and a culture that, you know, we can pray it away. We can't do that with this. We have to make sure part of your village is the people, like Jabina said, that look like you, that can support you, and that you have people in your household, your partner, your mother, your aunt, your good girlfriend, or whoever that core nucleus, you know, to that family is, that support system will hear this person, you know, say like, I need help, I need support, or be able to recognize triggers. Also understanding from a physical standpoint, what does pulmonary embolism look like? What are the signs and symptoms of postpartum preeclampsia? You have to get into like trigger warnings. That's one of the things that we, from a physical standpoint, that's one of the things that we teach at the MBDA, is just like making sure that you have the discussions with these birthing partners, holding birthing partners accountable, letting them know that they have a voice, you have to utilize it. This is your time to be vulnerable, yes, but it's also the time where you have to step up, because you're gonna witness symptoms and signs and behavior patterns that are gonna change. So some of those are identifying factors that could lead into something more serious, and we need to know what, they need to know what they are.
Absolutely. Linda?
I would just add, you know, yes, we have a responsibility to seek help and recognize what's going on, but also, even when we do, providers are much less likely to diagnose postpartum depression or anything along the spectrum when it comes to Black women in particular. I mean, you know, it's like 1/10 the rate of white women. And so inherent in that is just a Black woman can't, even if she can't articulate what it is, her provider is not likely to ask. Fleda Mask Jackson has a stress scale. And if every physician just offered the scale to his or her patients, that would be a great start at identifying issues that need to be addressed. But that doesn't happen. And so we unfortunately can't count on our obstetricians or our nurses to ask and diagnose or refer. So this is where doulas come in and play a really important role, because they actually know the birthing person and they likely can see a change, particularly if they're involved during that postpartum period.
That's a great point. We've had a couple of Facebook questions, so I want to get to them. And Linda, for this first one, I'll come back to you, because you mentioned, the question is really around something you referenced around cortisol levels. And the question is really around what can Black women do? What are practical solutions to lower those levels? Yoga, meditation, what else? And others can chime in after Linda as well. I'm sure you got some ideas as well.
Yeah, those are great strategies. What the number one thing a woman can do for herself is breathe. It is there, I kind of come at things from a data perspective, but it turns out that women, particularly pregnant women, but this is true for Black women, we don't breathe deeply, and that actually has emotional impact. So just breathing deeply into your lungs. There's something called 5-7-9, where you breathe in for 5 beats, hold for 7, breathe out for 9. You do that 3 to 5 times, it literally can reduce the amount of cortisol in your bloodstream by about 15%. But the other thing is to, as best you can, surround yourself with that support network that you mentioned, Stacy. Having the doulas, having your sisters, having people around you. And I'm not being trite at all when I say this, but no is a complete sentence. And particularly when you're pregnant, that is a word you should use early and often.
Love no.
You talked about breathing, and I realized I was sitting there holding my breath, and I realized I don't breathe as much as I should. what other ideas or things would you recommend to actually reduce the levels of stress? What do Black moms need to do to lower their stress? I love those ideas, Linda, but others.
Yeah, I think right now, specifically, avoiding, I say this as a journalist, avoiding taking in so much media that's Black pain, Black trauma. There was a very interesting study in 2015 that took place during the George Zimmerman trial, and it found that Black women, out of all other groups, exhibited more depressive symptoms associated with that time period and just being kind of immersed in what was going on with this trial. So specifically right now, limiting your media intake, being careful about what you take in, what you watch, what you're listening to. I think that's one real way to kind of to lower that stress right now.
It's a great idea. We had another, Tracy, I'll just come to you about this though, because we had another question on Facebook. Thank you for the questions on Facebook, by the way. Please keep them coming. Do you have any other resources for nonprofit Black doulas? Are there other resources? And I guess I'm sure we have your website, and we put it in the chat or the comments, and we certainly will have it at the end. But are there any other resources that you might want to mention for nonprofit Black doulas is the question.
I would have to, I need more information. I know there's Black Mamas Matter is amazing. They're an amazing organization. I know they're also based here in Atlanta. And the work that they do is tremendous. So I would actually say them, they come to my mind first.
Well, I think the other thing too is that we certainly want, having nonprofit resources is always really critical. I think at the March of Dimes, I just want to say this, that we're very interested in a different model of birthing in this country that incorporates doulas of all backgrounds and all colors as a essential part of our birthing system in this country. And if we're going to have that, doulas need to get paid, right? It is a profession. You have gone through training, Tracy.
So you'll see a whole different side of me on this.
So what we're advocating for at the March of Dimes is that we change our policies, so that midwives and doulas are paid, and it's a profession, a respected profession, where women like you, Tracy, and others can earn, a respectable income for doing the important work of bringing healthy babies into this world. Period. That's a full sentence, Linda.
Yeah, absolutely. You're here.
I agree with that, Stacey. And just to kind of further elaborate, we are often the gatekeepers. Doulas are often the gatekeepers. There have been numerous births that I attended before I retired from birthing. I no longer birth with families after 20 years of being in the field, but where nurses left me alone and said, okay, Tracy, just call us if you need us, because they knew that I knew what to look out for, and I knew what to do, and also still how to operate within that structure and of hospitals and their policies and procedures, but also still to usher that family and that baby out. I've had many of occasions where doctors have looked at me and said, well, we're not moving until you say so. So understanding the power, when it comes to the experience and the knowledge that doulas have, but also insurance companies need to be able to integrate that so doulas can be paid, so that burden doesn't necessarily have to fall so heavily on the birthing families too.
That's good. We had another question on Facebook. What would you say, the presentation of perinatal mood disorders is different between Black mothers and non-Black mothers? Jabina, do you want to start with that, and then others can chime in?
Yeah, absolutely. I think Linda touched on that a little bit earlier when she mentioned the language used by moms. And so we often use the Edinburgh scale, to just kind of, it's a diagnostic tool, right? And so, yes, I think the way that Black mothers describe their symptoms, oftentimes the symptoms that they describe are not on these diagnostic tools, and they can't necessarily relate to them, or I'm elaborating just a little bit more. And so I think Linda had mentioned, you know, if I'm calm, you know, like, you know, if my mind is right, my body is right, you know, my spirit's right, you know, if the finances are good, then things are good. And I think that that's important in this when we also talk about racially concordant care, as a Black therapist sitting across from a person of color or another Black mother, there are these nuances that I will pick up and understand the difference in those things. And so I think, yes, the presentation definitely is different, but the presentation will also be missed if you don't know what you're looking for as a non-Black provider. And so it's really important that we know what these nuances are. And there is some folks are working on some new tools, diagnostic tools. And so I will share some with you, Stacey, so that you can put in the resources. But yeah, I think there is a really huge difference. And that's how we are missing people in terms of using certain tools.
And Stacey, I'll just add to and completely agree with what Jabina said, but people who are not Black never have to worry about their treatment being impacted or not being acceptable if they have a question because they're Black. That's never a concern. So there's just this added layer that racism adds to a Black woman's risk for any sort of depressive symptom during pregnancy or after.
So I know one of the things that you all had raised in our prep for this is, you know, how our system of Western medicine really complicates mental health outcomes for Black women. Tracy, I don't know if you want to start with that, but talk about how our current system of care in this country really maybe even exacerbates and maybe even brings on mental health issues, especially for women that are pregnant, Black women that are pregnant.
Stacey, I'm trying to keep
I'm sorry.
my Tracy.
Breathe.
I'm
Linda
right.
says breathe, so that's what we're gonna do.
Because okay, how can I put this as diplomatic as possible? We have to understand the system that obstetrics and gynecology was founded on. It was founded on racism. Okay. So with that being said, and I mean, that's a whole history lesson within itself, and it is not designed for us. So it's not going to work for us in its current state that it is. And as far as from a mental health standpoint, you know, and it's been stated, you know, throughout this conversation that when you don't have a provider that looks like you, they're not picking up on these little nuances or signs and symptoms that could be potentially deadly in a gestating body or a recently birthed body. That's the more diplomatic response to that question that I can get, because it's very upsetting and it's hurtful because it's still the #1 reason today why Black women are dying.
And Kelly, beyond just the medical system itself, I mean, in the media, you know, I think that you talked earlier about how the media sort of portrays mental health and the stigma around it. Do you see nuances even in the media about how Black mental health is covered versus other mental health? Are there things that you're seeing that actually further exacerbate the stigma that exists already?
That's a great question. I think the main thing is that we've yet to normalize the idea of Black women being vulnerable. I think Tracy maybe mentioned this when she talked about the strong Black woman or the superwoman stereotype. And because we haven't really gotten to that point where we can talk about or think about Black women as vulnerable, whenever we do talk about maternal mental health, it is from a very white focused lens. Obviously, for my purposes, the key to changing that narrative is to having more Black journalists writing about these issues. And we're not quite there just yet. I've been writing about these things for a few years now. And of course, right now, more people are wanting to hear what I have to say about it. So I'm writing a lot more, but we still just don't have enough out there normalizing the idea that Black women are vulnerable and Black women need protecting, and Black women, have mental health needs. So that's kind of the first step for the media to take, is this position where we are talking about Black women more.
You all talked a little bit about kind of the tools that trained professionals use to identify and the gaps that exist in terms of identifying issues with Black women versus other women. What do partners, family members, and others need to be looking out for if there's a pregnant family member, a Black woman who's pregnant or just recently had a baby, experiencing some issues around struggling mental health? What are some of the things that just family members and friends need to be looking at? What are some of those warning signs that would sort of suggest, wait a minute, I think they may need some help? And I'll just open up to whoever wants to start.
Yeah, if I can answer. If this is your partner, your family member, your good girlfriend, your cousin, you know that person. And I think with that, knowing that person and knowing when they are not well. And I think that, there's baby blues, and we'll see that within the first 2 weeks postpartum. But if this continues on, if this person is not themselves, they're not getting up, they don't have enough energy, it's not easy for them to bounce back. Right. So baby blues, they can kind of get up and, they may be weepy, but they can get up and change the diapers and like make a bottle or nurse or do, but if you're not seeing that energy, if you're not seeing the person that you once knew, I think that's just really small and really minute. It's just this change and shift in that person. It's important for you to ask the question, because oftentimes, even if you're that really good friend or you're that partner, you may not want to ask, hey, are you okay? I often say, don't ask, are you okay? I say, because people just say, I'm fine and I'm well, right? I'll say, ask, how was your day today? How do you like the baby today? How do you like being a mother today or a parent today? What made you smile today? And if they can't answer those questions, right? Or they may answer it, and this will give you an indication as to how this person is doing. And so I would say to family members and friends to kind of look out for these behaviors that is just unlike that person. And then in terms of depression, anxiety, those are some signs and symptoms that, not eating, not sleeping well, very weepy, agitated, things like that. But you as a friend or family member, know that person better than any doctor, any provider. And so you may likely be able to pick up on some of those things beforehand.
Yeah,
That's
and
great.
The Association of Women Obstetric and Neonatal Nurses has its post-birth warning signs. And I know there's some work going on right now to update those warning signs to be more appropriate for African-American women, because they're not the same, and the things we should look for are not necessarily the same. So when that's done, hopefully that can add to what Jabina is talking about. And every woman and every birthing person and partner needs to leave that birthing space, wherever it is, with a set of these warning signs and to know what to look out for. But importantly, someone should be checking in on a regular basis, not 6 weeks later.
Yeah.
And that's a little bit challenging during the pandemic, right? A lot of us shouldn't be going over to, if we haven't been isolating with a new mom, we shouldn't be going over to her house to check on her. We can't do that. We have to do FaceTime. So we have to adjust a little bit, right?
Absolutely.
Can I also say something? Also,
Yeah.
understanding that every pregnancy doesn't end in a live birth.
Yeah.
So, there may be some grief associated or grief that the recently birthed parents have experienced, or the release or the let go of a birth not going how we anticipated it should go. So they may have a live baby, but maybe they wanted an all natural birth and it ended up with an emergency cesarean that was under, you know, they were under general anesthesia for. So we need to honor the fact that there is possibly a grieving that could be taking place. And we need to allow safe space for that. We need to allow, you know, verbiage for that, and let them know that it's okay. And that it's okay to grieve. You have every right.
And you know, there was an interesting article I tweeted yesterday talking about miscarriage and the impact on fathers. And I know we're talking about Black maternal mental health, but the article was so fascinating. When I tweeted it, a Black father sent me a message and said, "Thank you for sharing this," because apparently he and his wife suffered a miscarriage, and the article was that dads often don't allow themselves a time to grieve loss. And then they end up suffering mental health issues while they're trying to support the mom, where the focus obviously is because she's lost the baby, but the loss is felt also by the partner and the dad, and allowing time for grief for both parents, I think, is really an important point, and we can't lose sight of that.
Yeah. Stacey, if I may add to that point, yes, that 10% of dads are experiencing postpartum depression. And so it's really important that we uphold the birthing unit, right? Although my quote says everyone wants to hold the baby, who will hold the mother, but also holding that birthing family. It's so important because, especially for Black families, it's added stress on all levels, you know, and we, you know, won't get into the stresses of the Black man, but if we think about all the stressors of the Black man and the Black man who is a part of this birthing experience, we can only imagine the added stress when that person brings in a child into this world. So yeah.
So for that mom that's trying to prepare her birth plan, she's preparing for birth, so she's thinking about, you know, prenatal visits that she's got to continue to make. She's thinking about what she's got to plan and prepare in terms of delivering the baby. Are there things that women can do as a part of their birthing plan to help make sure that they have the support that they need for their mental health? Are there resources they should be planning to know how to access, and how important is that to build that into a birthing plan? And Tracy, do you want to start with that?
Yeah. We like to use the word birth preferences or birth wishes. When we term things as planned, it means that this is how it's absolutely supposed to go. So first of all, the birthing parent knowing that they have as much permission as possible to birth their baby. And we have to be as fluid as possible because birth is a lot of moment by moment decision making. So with that right there, when they release that stress of it's going to have to go this way, there's that breathing that Linda was talking about. It's like, oh, okay, so I don't have to put all that pressure on myself. But I'm an advocate for therapy. I'll take my therapist wherever I go. So I don't care if we're pregnant or not, let's have a therapist on board. And one of the things that's extremely crucial for any birthing family, and especially, you know, a Black birthing person at this particular time, is a postpartum doula that's also a licensed therapist. Mm-hmm. When we talk about putting a team together, we cannot leave that person out. This professional has to be in that professional Rolodex, because once again, birth may not go as we think it should, and we're dealing with a grief process or something traumatic, because in COVID-19 and isolation and birth trauma and being Black in Western medicine, there's always a possibility that you need that added layer of support. And having that licensed therapist who's also trained as a postpartum doula is essential. That will make a difference from, you know, normal postpartum blues to postpartum depression.
There's a question that just came in around bereavement doulas, Tracy.
Yes.
Is that similar in some ways? So, or are those even more specialized than postpartum doulas who are also licensed therapists?
They're actually a little bit different. So a bereavement doula can cover anything from supporting a person who has recently miscarried, And then there's also on the latter end, so in death. So if you have an elder or a person who is transitioning and they want a bereavement doula to support them during that particular time. So yeah, doulas, that's the beautiful thing about the field. You can go anywhere in the spectrum of life with it.
And then I just want to ask this last question, which is, we talked about the medical system, the health system, as it's currently, structured. If you had to suggest one or two major changes to the way our health system addresses Black maternal mental health, what would be the one or two things that you would most fundamentally want to see changed? Linda, do you want to start?
Yeah, I would tie reimbursement to maternal mental health and infant health outcomes, particularly in light of the disparities that exist for hospitals, for obstetricians, for nurses. I guarantee you, if payment was connected with successful outcomes throughout the fourth trimester, so through 365 days after delivery, we would see a significant decrease in the disparities in both infant and maternal deaths and morbidity.
That's great. Kelly? Kelly?
Yeah, can you repeat the question?
Yeah, if there's, given our system around mental health, what is the one, or is there one or two things that you would like to see changed that could make a big difference in improving Black maternal mental health outcomes?
Yeah, right now, most mothers don't really, or most women are entering the healthcare system because of childbirth, because of pregnancy. I think taking care of Black women early on in the healthcare system, I think that focusing on that, I guess that more preventative part where we're focusing on Black women, their special, social determinants of health, cultural needs, starting that early on. I think that's key. I don't think we talk about that enough.
Especially with young girls, right? Even as early as the teenage years, maybe even earlier, really helping them understand the importance of maintaining not just good physical health. We're good about talking about physical health. We're not so good at talking about, hey, how are you doing right now? How's today? And really asking girls to feel comfortable talking about their mental health and feeling like they have a safe space, as we mentioned earlier, to talk about their own mental health and maybe what their needs may be in that space. We got to figure out how to create better language and a better way of addressing that. I agree. I definitely agree with that. Tracy, what should we change with our current system?
I need to get rid of it all, if you ask me. We can't put good stuff on top of a faulty foundation. It's still going to fall. So that's where I stand. We really need to dismantle the entire system. We cannot talk about like defunding the police or changing areas of education if we're not also addressing Western medicine in this society.
And putting resources behind making sure maintain. Absolutely. Yeah, I agree with you. Jabina?
Well, I must say, I wholeheartedly agree with Tracy's response. And I think when in terms of addressing mental health, just racially concordant care, we need more therapists and providers of color, trained clinicians that are able to identify research for us, by us. So more research from Black researchers with the lens to address our community differently. So, yeah.
That's great. Well, thank you all for being a part of this today. This has been terrific, and you guys are amazing and so passionate about all these issues. As we close out the webinar, I just want to say not only thank you to the panelists, but also thank you to you all who've been viewing this and watching this. Hopefully this has been really helpful. Women and couples and families are making some very difficult decisions. They're living through some of the most difficult times that frankly any of us have had to live through, with layer upon layer of challenges that we're facing today. It's really challenging, not only our physical health, but certainly it's challenging our mental health. And a lot of us, we got started with this webinar series simply because we couldn't imagine all of the questions that pregnant women would have and new moms would have in trying to navigate having a baby in the midst of a pandemic. And we certainly want to make sure that as women are trying to navigate these very challenging times, that they're getting the support they need for their mental health as well. We have a resource slide with just a lot of links that some of them were mentioned, others may not have been mentioned. We want to make sure that the links of where to go for more information, the organizations that are represented on the panel today. We have this available, and I'm sure we'll have it in the comments and available for you on Facebook so that you can follow up with the organizations themselves. I know they all would love to kind of be of help to anyone that really needs help at this time, or if you have friends or family that need help as well. I just want to say thank you again for doing this. You know, part of what the March Times is doing in providing this kind of support is to make sure that we can continue to bring this kind of support to everyone in communities. And these webinars have been just one important way that we've been able to reach out to people to make sure you know that we're here for you. We're here to help support moms and pregnant women and women that are starting their families. The support that we get is incredible. And we want to encourage you all, if you want to continue to support the March of Dimes in our work, please do that. We've got great organizations represented today who need a lot of help and support too. So we really want to encourage you to consider giving to the organizations that are here as well. But just remember that moms and babies, and especially those of color, need us now more than ever. So please text the give at MOD-GIVE to 51555 to donate today. Again, we encourage supporting the organizations that are represented here today as well. But as we close out, I just want to say thank you again to the panelists. Thank you for being a part of this. Thank you for lending your expertise, your voices. Thank you for doing the important work you do every single day. We're so grateful for you. And again, thank you for joining today, and good afternoon to everyone. Thank you.